I mean, that should definitely hit two different levels as far as hitting and increasing natural growth hormone in the body. So in the morning, we talked about on an empty stomach, at least 30 to 45 minutes before you eat anything, and then at that point later on, right before you go to bed. Now, like I said, the good thing about testosterone is, it's a GHRH peptide, so it's a growth hormone releasing hormone peptide. So it's going to help release that natural growth hormone in the body. So that's going to do a lot just by itself, right? But the other side effect, and the good side effect about it, is that it helps target visceral belly fat. So, in that stomach area, and there's nothing else out there that targets visceral fat. Hardly any visceral fat there at all. But so there's hardly anything out there there's nothing out there that specifically targets a specific part of the body with fat. Right? Weight loss is an overall effect. Even with IGF-1 or whatever it is, even growth hormone, you're losing weight all over. So this was really cool, and that's why I was like, it's FDA approved. It does these two functions. I think this would be beneficial for a lot of people out there. And a lot of people, I just talked to one of my friends, Eric. He just came down from Chicago, looked at his blood test with him. He's a patient with us. And at that point, like his growth hormone level, like he's at literally the bottom of the reference range. The reference range is like 84 to 250 on his age group, and he's at an 88. So he's literally 4 points above. And his testosterone levels, estrogen levels, everything looks great. But he's like, man, I still feel kind of tired. And I'm like, that's definitely why you still feel kind of tired, for sure, 100%.
Okay, that's incredible. I have Bobo is it okay to talk about you right here? All right. Is one of the Titan crew guys, but he's also over at Titan Medical. And I was trying to figure out a couple protocols for him.
Mm-hmm.
This would be a great one for him.
Mm-hmm.
Just taking it before sleep at night will help the release of growth hormone,
Right.
Help him better sleep, better recovery, but also will help cutting some of that fat that we spoke about.
Yep.
And so that's good because I don't want to say that you're fat, but you're fat. So this will be a nice thing now that he is starting to diet and starting to cardio. This will be a nice added touch to that level.
Mm-hmm. Definitely.
Okay, and just still staying on you for a second. AOD would be a nice added touch in the morning to help attack that as well.
Mm-hmm. Mm-hmm. That'd be a good one. The other one that we're seeing pretty good results with is one of the newer therapies that we're offering too is MOTS-C. MOTS-C is definitely working. It's another peptide therapy, and what it does is it makes the body mimic exercise. Literally, it boosts the metabolism.
Oh, don't say this.
I'm not joking around. I mean, that's literally like any research you see about it. That's kind of what they call it. And I don't like to say this term.
M-O-K?
M-O-T-C. That's C, yes. So it's M-O-T-S, MOTS-C.
Okay. And how can you go into depth on how that even, before we jump onto anything else, how does it mimic exercise?
So, sure. It works at the cellular level to boost the metabolism to the point where it thinks the body is exercising without raising heart rate or anything like that. The other thing that it does is it actually it helps glucose levels. It helps regulate glucose levels, and then the other thing is it uses glucose and it uses as energy, so it never stores in the body too as well. So it's kind of got that AOD effect to a certain extent. So it's very, very cool. I mean, like I said, there's a number of patients that have been taking that one too, and Sharice is one of them. And she's always a non-believer. Like Sharice does not like to do injections. She'll take some if she needs to and all that, but there's very few that she can take because of some of her medical history. Like she can't take testosterone or any GHRH because it revs her cycle up, and then she starts getting a lot of stomach pain and bleeding and all this stuff. So at that point, she's been taking MOTS-C, and it's something that you only have to take 3 times a week. So it's not even a consistent everyday thing that you have to do every single day, like testosterone or whatever it may be. And at that point, like it's helped definitely. Like when it uses the glucose energy, she said she felt actually energized. So that was a good effect.
Wow, that's nice.
And then if you're boosting metabolism, I mean, she's definitely lost weight, and she hasn't been going to the gym consistently. Diet hasn't changed any than what it's been. And at that point, like I look at that, right? That's one. And if you get Sharice to be a believer, it's because it works. And it takes a lot for her to do it because she won't believe it if I tell her or
Right.
somebody else tells her until she takes and she's like, oh wow, this really works. You know, it's like a lot of people out there, but it's definitely it's been a good one for patients as far as that goes. So, you know, it's something a little bit different.
Okay, this is great because I'd like him to start, not just getting in shape, but trying to get in better shape than he's been in the last 10, 20 years. And
Of
again, I'm going to go
course.
right to you on this stuff because you're the one that
Yep.
knows better than, by far better than I do, but also better than these people that are out there that have companies that are trying to do this protocol.
Yep.
It seems like they just pull in the doctor and let the doctor do it. But you're learning as you go and continue to study and study and study, which
Of
I love
course.
about you.
Of course.
So if anybody's just tuning in right now, again, we talked about tessimonial, which was one of the big ones that we started last week and that I received. And I will also let you guys know my take on what it does for me.
Hmm.
And then this week we have a protocol or a peptide of the week, I guess you would
Yes.
say.
Yes.
And I have it right here because I am on the email list.
Ah.
So I get the notifications every Monday on saying
Yes.
what's going on this week,
Yep.
what's there to help, and I'm loving this one because again I'm a skin guy and
Yes.
see if I'm correct or not. But please take over here. What is this week's um,
Therapy of the week.
therapy of the week, my
Sure.
friend?
So therapy of the week this week is a peptide therapy. It's GHK CU. And GHK-Cu is a copper peptide. And this peptide is awesome. And so this peptide can help in a number of different ways, especially for the skin. So it helps produce collagen. So that's something. Elasticity in the skin will help with. The other thing, it helps with skin remodeling. And you're like, what's that term of skin remodeling, right? So it helps with wrinkles, right? Lines, wrinkles in the face. So at that point, it can remodel the face or the skin to a certain extent. It's also great for wound healing and regeneration. So if you've gotten into an accident, you had a surgery, something's happened, this can help repair the skin at an expedited rate, and it's really good as far as that goes. It also has anti-inflammatory and antioxidant properties. So if you have inflammation in the body, this is good to take away some of that inflammation. And as far as antioxidant wise, it's always a good thing, especially for the skin and fighting free radicals. Free radicals are the enemy to a certain extent if there's an abundance of them. So there could be a lot of damage that can be done DNA wise, skin wise, and all that. So this covers pretty much all of that, which is really, really cool.
It's interesting because I think some people will say, "Well, I don't have a skin issue and stuff," as they are.
Injecting
Maybe
Botox.
off season or something like that. And so my curiosity though is I don't think people realize, or maybe they do, as you diet down, as you get older and older and older, there becomes something that happens to the skin. And so this is kind of a good preventative
Hmm.
issue if you're using something like this to keep the skin healthy as you are aging, because we're never going to be as young as we are today.
That's correct.
And
That's correct.
so, how can I help myself in the next 5 years, in the next 10 years to be healthy, healthy, healthy? And so that goes back to me again. One of my biggest things for myself is that healthy skin.
Hmm.
I
Hmm.
always see that it doesn't matter how ripped and muscularly you are, if you do not have good skin covering that, I can't see anything. And so, go like John Cena, was on stage this weekend. And again, I know people will say 46. Well, he's not a legit 46 in the sense because he's always trained, he's always been healthy. So he's
Hmm.
not the average guy, but he looks great.
Yeah.
And again, he's taking care of himself, he's eating well, he's staying in that protocol. But if that's something you want to chase, you know, to look like John Cena at 46 or anybody, you know, I think this is a great protocol right here to make sure your skin is healthy.
Absolutely. Absolutely. I mean, a lot of people don't take. Well, I mean, I guess you got your 50-50 balance. I don't even know what the split would be really, but you have a lot of people out there that really do take care of their skin, right? They have all different types of lotions and all these different things, and the creams and all these different things they're utilizing. And then you have people that are taking Botox and these fillers and stuff like that too as well, because it works. It's instant gratification. It fixes the problem immediately. But then you got people out there that they don't take care of their skin at all. I mean, no lotions. They're using the worst soap because it's the cheapest, or they have to get by to use it. Totally understand that if that's the case. But it's okay when you're younger, I guess, to a certain extent. But as you start aging, if you do not take care of yourself, everything is going to wither and everything is going to start breaking down from the inside to the outside. So, and if the inside's even worse, you're probably going to break down the outside just as fast or faster. So it's something to really, take in consideration, to be preventative about your health and about, everything think about it. Your skin covers your body. It's the biggest protector of you out there, right? It's covering everything. So you take care of it along with your body. That's a part of your body, and you need to take care of that too. So, to do some things like this, I think would be beneficial for a lot of people out there. And I think might save them in the long run to have to, maybe delay the process. Because I see a lot of 20-year-olds getting Botox right now. And the way that these people are slanging it to these kids, because they are kids, like 21 years old, is that it's a preventative. And I'm like, really though? I mean, they could probably do something else at 21 years old. When you start getting your 30s, or if you have a whole bunch of wrinkles and all, listen, I'm not against that at all. Do it, right? But if you can prevent things and even make things better while you're taking some of these things like Botox or Juvederm or whatever it may be, you can utilize some of these different therapies like GHKCU and actually help your skin be better. So at that point, maybe you won't have as many wrinkles to have to inject, or maybe, your skin and your arms is going to be better, your legs is going to be better, your back is going to be better. And like you said, if you got bad skin, but let's say you're the most jacked up dude there is, and you have horrible skin. You take your shirt off on the beach. Now, whether it's acne or acne scars or a whole bunch of blotchy skin, or it's just your skin looks like it's a crocodile because you've been out in the sun for so long and you don't use anything to protect yourself. It's not going to be as confident to take off your shirt, right? Yeah. Instead of, listen, you got beautiful skin, take off your shirt, you're nice and ripped. It looks aesthetically pleasing all the way around.
I'm 100% with you. And kids at 20, in their 20s doing Botox, I guess I can see the point, the preventative in sense, but I'm back to you on that might be a little premature, but that being said, I had my dermatologist over this weekend, and yes, I have a dermatologist, very much so because of the fact that the skin and skin cancer runs huge in our Irish German family. And so we became friends, but we were talking this weekend about me getting back on like Retin-A for my face and stuff like that. And they were talking about how beneficial it is for the skin. But I would compound that for me with the GHK along with the Retin-A to help fight against deterioration or that lack of healthy skin. So just for anybody out there, that's my belief.
Yep.
Just to keep the healthiness. And again, for me, the skin is more important than my muscle. Because, if I'm 270 or 200, it's the skin that's going to be the most visual thing. And I want that the healthiest than anything else. Definitely. So what is there a sale on this, or is there a protocol for this? And then who should be looking into this? Should it be the person that's starting their diet, maybe losing weight, or is it just anybody and everybody?
I think everybody and anybody can benefit from this therapy, really, because you're preventing it as far as the skin, you're making it look healthier. Hopefully you're avoiding wrinkles or remodeling the skin to get rid of some of those wrinkles or lines. So that's a big one. The anti-inflammatory and the antioxidants too. As far as that goes, that's just going to be a benefit for anybody out there. So there's not really anybody that would not benefit from this therapy, I think. And then as far as that goes, it's a 1-month protocol. It's usually $300 with the $25 off. It's $275 for the 1-month protocol. That is injectable. We do have an oral form of it, but the injectable is going to work a lot better for patients out there. So, if patients take the oral form, they don't get the great result like the injectable, because this can work over weeks or it could take over months for some people. It just all depends. So as far as that goes, it's not really a timeline like, hey, listen, in 10 days you're going to see all your wrinkles disappear or anything like that. But it will work, and it does help immensely as far as that goes for patients. And even with the serums, so we've got some different compounds with some different creams and stuff like that with retin-A, GHKCU, vitamin C, and different things. So we're going to start getting into that too as well. Start pushing that out there for people that want it, because there's a lot of people out there that do want it, and we've just been so busy.
That's a great combination right there.
Yeah, I've got some really good ones.
That's
some really good ones.
Smart.
Yeah. We started developing the Titan skincare line, and we've got a couple of different compounds we've already put together for it. They're all prescription based, so you can't get these things over the counter either. So it'll be a combination that nobody will be able to get, and be compounded specifically for the patient or what the patient's needs are.
Wow, smart call on that. What is next for Titan Medical for this week and the coming weeks? What's the game plan over there? You guys are always so moving and grooving. I know that I'm going to plan a trip to come out there in April. Yes. So if you guys are in Florida and close to the location, the headquarters, I'll make sure I'm available to say hi to you guys and come down and maybe get a B12 shot that day or something like that down at the headquarters.
Yes, that'd be awesome. For us right now, we're pumping out videos right now as far as that for these new therapies that are coming up. So I'm getting ready to do some of those. It's just been a lot of craziness. We've got right now, this weekend, we don't have anything, luckily, for Titan Medical Center as far as that goes. Next weekend, I'll be down in Miami. And then the following weekend after that, we have the Clash series that's going to be in Orlando. It's a Pro-Am show. But that's really about it. I mean, right now, we're just been developing new therapies right now and pumping out content for those therapies as far as that goes. So that's what we got in the works. And we've got a couple of events that we're planning on right now. New clothing coming in for girls and guys that's getting worked on and coming in too as well. So it's just been one thing after the other. I mean, it doesn't stop.
It doesn't stop. I know that about you. Somebody had a question here. Do you see that one?
Yes. Is Motsy something you can take with thyroid nodules? That's going to be up to the provider. I don't think there's any counterindication for that medication with thyroid nodules, but I'd have to ask the provider on that one. I have not asked that question as far as that goes. Now, I do know that if you have thyroid nodules, you're not allowed to take like semaglutide, tirzepatide. Those are specific. That is one of the specific contraindications for it. Or any GHRH peptides. So testosterone's out the door, CJC's out the door, just because we don't want any growth of that nodule to happen, because some of these nodules can be cancerous or become cancerous later on.
So am I understanding this correctly, that a nodule would be something that's on their thyroid or their lymph node in a sense that at this time maybe is not cancerous, or they just don't know?
That's correct. It might not be cancerous, but it's a counterindication directly from the manufacturer as far as that. Semaglutide, tirzepatide for thyroid nodules. Motsy I'd have to look into. Like I said, I haven't crossed that path with a provider yet. So I'll ask the providers what they think, and I can get you an answer on it.
It's a great question. Thanks for asking that.
It is a good one.
What about, so you guys talked about testosterone. What about, is it money aside? If money's not an issue, what about taking testosterone with CJC, with MK67? Is that pointless?
Did you hear that?
Yeah. So you're talking about
taking... Could you repeat that to the fans?
So he asked about taking, if money is not an object to anybody out there, would it be beneficial to take tesamorelin, CJC 1295 with ipamorelin, and MK677? I think there's a lot of overlapping that you're going to be doing with that. Do I think it might be beneficial? You might get a little bit more points as far as IGF-1 levels. It might stimulate a little bit more, definitely. But it should if you're taking all those medications, right? Which one of those medications should take you, to the levels that you're supposed to be getting to. So, I don't see a no. Like, let's say, no, you can't take it. But I think that, I think bang for the buck, I don't think you'd be getting the bang for the buck that you should be getting. If I'm just being honest with you.
And you explain this much better than I do. I know that certain ones work slightly different,
right?
And so in the take, if as long as they're working on a different way
mechanism
to get the HGH, their human growth hormone, to activate, or your growth hormone, then it would be a smart thing to do, or you could do
Sure.
both aspects of it. But if they're all working off the same format,
Yeah.
then it wouldn't be.
Yeah, that's exactly right. And they do work a little bit differently. So at that point, I mean, some of them utilizing would be able to maybe stimulate a little bit better, you know. But you know what I would do is I would I'm a testing guy. So at that point,
Yeah.
I would do the therapy, 30 days, see where I'm at. 60 days, see where I'm at. And then if I didn't bump up to where I thought I wanted to be, then I would add something else into the mix. And then I would test 30 days later and see how that's bumped up. Because honestly, if you're taking those therapies within 30 days, it should do some sort of bump. Something, right? Something. It doesn't have to go up crazy. It won't be the optimal or maybe the top peak of what it should be doing, but it should be doing something in 30 days.
Where would be, I mean, obviously it's on the individual and stuff, but what is a good range for your numbers on your GH?
Sure.
In that 200, let's just take the average guy for the, you know, that's in between the 85 to 200 range. Is 200 the goal? Would that what the goal would be?
Yeah, so I mean, reference ranges change by age on demographics.
Right,
So
right.
you know, so the older you are, the lower those levels are the reference range. The younger you are, the higher they are. So at that point, yeah, if your reference range was say 88 to 200, 200 would be a good range to be at, right? Do I want to get it up over that range? I would
That's
say
the
yeah.
question.
Hell yeah. Yeah.
Okay.
I mean, I'm just being honest with you. I mean, you
Right,
want
yeah.
a higher IGF-1 level, right? And not super physiological high. Like there's some guys out there taking like of real growth hormone 6 to 8 IUs a day, and like their levels are like 600, 700. That's a little too much now.
Okay.
And now we can start getting overgrowth in organs and all that
Right.
would be negative health wise for the patient. But you know, if you're up at let's say 300,
Okay.
I'm not going to say that's not bad, dude. I mean,
Yeah,
you
we've
know,
had discussions on the podcast where some people were saying they would like to get it to like 400 is some kind of magical number somebody was saying once, and I'm like, all right, that's interesting to know that. I mean, obviously, if you're sleeping well and you're doing something and this is optimizing your health and you can get it to 300, that seems like it's just going to help stay youthful and really
100%
you're going to be able
Anti-aging.
to train harder, eat
recover,
better, recover better.
sleep. I mean, everything's gonna be clicking when that IGF-1 level is up, and everything else is in balance and optimal.
Right.
You're gonna be dialed in, and that is the way your body is going to perform. It's going to perform like it's dialed in. If things are off, it's not going to perform at its optimal, you know, level where it should be. So that's really key. And you know, IGF-1 is definitely a key part of everything that's going on inside the body too. So I mean, all these things are connected, and they all play their roles. Some play a more important role than more than others. But at that point, you know, that's definitely one you need to look at for sure. Because I'll tell you this: like I've got my levels up to 400, no problem.
And how did you feel at 400?
I feel like a champ, dude. I used to sleep. I mean, REM sleep was off the charts. Like, you know, I mean, you definitely feel better. And
You're a good sleeper as is.
yeah,
Is
try to
that
get
not
the best
true?
sleep.
Is that pretty good?
Pretty good, you know. I mean,
Okay.
the only part where I get bad is that if I have to stay up late, I'm an early riser no matter what. If I go to bed at 3:30 in the morning, one of those
still
nights
up.
I'm out, I get up, man, and that wrecks my sleep and it wrecks
I'm
me
not
for me
hanging
a
with
couple
you.
days, you know.
I'm not hanging with you on Friday and Saturday.
So yeah,
You'll wreck me.
I don't do it every Friday, Saturday, but when I do, like, you know, occasionally, you know, it's for me, it takes me a couple of days to get back in the routine, get right back where I need to be. But once I get back into that routine, I think everything works a lot better. And that's another thing. If people have poor IGF-1 levels, you guys need to prioritize sleep. There's a lot of people that run themselves down and burn the candle at both ends. And you know, whether they're going out for sales meetings, they're drinking, they're around people smoke. I mean, you got all these negative things that are hitting you, and that will lower your levels too, for sure, 100%.
I got a question for you, and this is a personal question. If you can answer this,
Okay.
what is more important to John, your testosterone level or your IGF level? And if you can only choose one,
Damn.
yeah, I know. I just thought of this because I'll go first. I think my IGF level would be more important as long as I'm recovering regardless of what the testosterone is, as long as I'm recovering enough and sleeping well enough, it gives me a fighting chance compared to vice versa, where the testosterone was great and the IGF is not. That means I could be strong and whatever, but I'm not recovering as well. Am I wrong on this aspect, or my belief, or
I mean, it's a hard one.
it is a hard one?
It's a hard one because I mean, you know, when you
Do
talk,
you need to recover if your testosterone is up so high? I mean, you're going to recover anyways because your testosterone's so high.
yeah, I mean, you know, one thing. So if your IGF-1 level is up high and your testosterone is low, you're still going to have the symptoms of low testosterone. So that could be like ED. You could have you know, as far as brain fog and all that stuff that comes along with it. With IGF-1 levels, and I've never had my levels deficient, so I can't talk about that. But I know with testosterone being low like that, there was a game changer for my testosterone. I had an average IGF-1 level when I first started testosterone, so it wasn't like I was balling then, and that did a big jump for me as far as that goes. But you know, with anti-aging purposes or aging faster, IGF-1 being lower, that's definitely going to happen. So you'd have to combat it some other way. I would probably, I mean, that would be such a hard
question,
decision.
though,
It's
right?
a tough one. It's a tough one. I think, though. I mean,
You know
think
what's nice? The nice is it doesn't have to be one or the other.
Thank God.
They can both be great.
Thank God.
They both could be good.
Thank God.
But that's going to stem from somebody going, let me find out where they are. Let's go get the blood work. And can we do any kind of, like, to anybody that's on here right now, should they call up Titan Medical and get a discount on their blood work?
Absolutely.
Maybe for these guys and girls out here.
$130 for guys instead of the $150 discount to the $150 discount. So $130 for guys, full in-depth blood panel. Girls, $200. That's full in-depth blood panel. And that's usually $300. We usually discount it down to $225. It'll be $200. So you guys save an extra $25 on the panels if you guys mention Mike in the show today.
So the phone number is right there at the very bottom of the screen. So get on over there during this time. The reason why I think both Johnny possibly agrees with me on this is that we don't know where you're at without the blood work.
That's right.
And getting peptides or getting testosterone, whatever that may be, it has to come off of the blood work, not a guessing game. We're not in that. Listen, guys, when back in my day, it's like those guys had to do a guessing game.
Yep.
Because you can't just go get a blood work. And now you can. You can actually go to see what's going on, and do you need something or do you not need something?
Right.
And then the great thing about Johnny is he can explain things that even if you don't need testosterone right now or something to bump up your IGF, there's so many peptides that help you with training, body fat cutting, healthy skin, healthy hair.
Yes.
So there's a plethora of stuff that you can do, even if your body is functioning at a good level.
Yeah. Hormonal wise, if you're good, there's still things that can complement and you can utilize for tools to accomplish other goals that you're trying to achieve. Mental clarity, building lean muscle mass, losing weight, better performance in the bedroom, better performance outside the bedroom, whatever it is you're doing. I mean, there's a lot of different things you can dial in. I mean, even just for preventative health. That's another thing that people need to start doing is being preventative about their health. So they don't break down. So things aren't like hitting you out of left field, like, oh my God, I'm going through this right now. Or even to maybe possibly diagnose something that might be in the early stages that you can take care of in the early stages instead of it being to a point where it's not looking too good. So, you know, there's a lot of different things that go along with it. And like I said, preventative health is everything. And being proactive about your health is everything too as well.
And if you are going to, like, I see a lot of questions here, people asking me, hey, should I do creatine? Should I start working out? I'm in my 30s and 40s. Goes back to what you and I have always talked about. Get started, get moving, get your blood work done, and then we can add things in there that you need as we go. But the main thing is just getting started. And
that's right.
Number one thing is giving a phone call, 727-389-3220, Titan Medical. Let them know that the Titans sent you over there for the Titans.
That's right.
And get your blood work done today. And if you weren't here at the beginning of the show, I was talking about my guy over here, Bobo, that his testosterone is fine. He doesn't need anything there. He doesn't need anything else. But what he can do is he can optimize his training right now with some of the stuff like the AOD and tesamorelin and
Yep.
stuff to get some body fat going. So that's again just for you guys at home. And then Jeff over here, you just double the dose, hope for the most.
Well, that's why I asked.
And that was a great question he did, and he was the one that asked the question about, well, can't you double or take two different types of tesamorelin and MK or something like that?
Two better.
Yeah. And then where is that come into play? Is I mean, we just talked about IGF. When it comes to, I think, testosterone, if it's okay to jump into this today,
Sure.
I think a lot of TRT companies do a combination with testosterone. They do the test, but an additional something. Is that not correct? Is a lot of companies do that?
I was kind of asking that.
Okay.
47 took TRT recently, went from 430 up to 1300. Energy and sleep were dialed in. Physically, drastically transformed. I was wondering, is there any other peptide that could be combined with TRT for optimal performance / recovery?
Sure.
Great question. Thanks for asking that.
Yeah, that's a good one.
Johnny, that's all you, my man.
Sure. So I mean, yeah, you can definitely utilize a couple of different peptides. One, you can use BPC 157, TB 500 for any healing or proactive preventative for the ligaments, joints, tendons, and muscles, just to make sure everything's going to be good at 47. I don't know if you have any aches or pains, it could definitely help out. But to really complement it, I would definitely add in a GHRH peptide. So tesamorelin, CJC 1295, ipamorelin, MK, these are going to definitely be beneficial as far as helping you gain more leaner mass, get rid of maybe the fat that's on the body, and then increasing growth hormone levels, which I think will complement the TRT really good, especially at 47. I don't know what your levels were at originally as far as IGF-1 or if you even know. But it's something that I definitely think would be beneficial as far as that for an older gentleman or an older woman at that point. Just depends on where their levels are at too as well.
I was just talking to the team here while you were going over that. Is a TRT protocol testosterone with Anavar? Is that something that some of the companies are doing? And what would be the reason for that? Is it because the testosterone didn't work well enough, or they want to get a better number, or it might just
no?
Is that gold Jim Venice talking and everybody trying to get on more stuff?
It's just that's exactly what it is, and what's going on. And it's listen. When I first got into this 11.5 years ago, I went to pharmacies and I was trying to get pharmacies to be picked up as being a vendor for me. And I bring up my list of what medications I was looking for, and oxandrolone was on there, which is the main active ingredient in Anavar, right? And decanandrolone was on there. And when I turned that list into them, all these people looked at me like my head was spinning. And I was the exorcist. We're never going to develop this drug. We're never going to push this out. I'm like, okay, cool. Well, fast forward to now, every pharmacy and their mom are pushing out oxandrolone, 10, 20, 50 milligram tabs. They're pushing out nandrolone, winstrol. I mean, you pretty much got your cake and eat it too if you want to really get into that, and people are really going to prescribe that as physicians. Now, as far as oxandrolone with testosterone, most places are pushing the oxandrolone as a weight loss therapy. They're not even pushing it to raise testosterone levels. They could care less. They're like, oh, this is going to get you in better shape. It's going to harden your muscle. You're going to lose weight on this. You're going to cut up. And are
they doing that also with the winstrol and stuff like that?
Yes. I mean, I seen testosterone decanate. I see Bolderon. That's equipoise. Bolderon. As something that we could have prescribed to a patient. Will we ever do that? Hell no. Hell no. There's no medical inclination of why we prescribe that to a patient. And you got a lot of providers out there that, to me, I think are playing a risky game with their license, because it only takes one time for the DEA to come down and crack on your door. And once they go, they're not going to leave. So at that point, they're going to start, really looking at your stuff and what you're doing there, and oh man, what, 50 of your patients got oxandrolone for what? And then you're like, oh, and then like, oh, well, we're going to report you to the medical board. And once you go in front of the medical board,
I see.
what happens is you have to get into a jury of your peers, and then they ask you, what was the medical inclination of you prescribing this to a patient? Why? Now, medical providers is the hardest thing to take away their license. It really is. I mean, even these guys at the opiate pandemic and stuff like that, a lot of these guys didn't lose their license, right? Because it's up to the physician, it's up to their discretion of why the patient is going to take the medication, and do they think, in their opinion, that it's more beneficial for that patient to take it than not. So it's just, it's crazy. Like I said, when you start...
Would this be an issue with the receptors? So I don't know if people all realize this, that testosterone doesn't work the same for every individual.
Right.
Somebody can take it and their receptors are just so open to it, and they could take a small amount and they become monsters.
Yes.
That's why, like in the health and fitness world, they talk about this guy's a gift because he just a little bit and he just huge.
Super responder. Yeah.
And then there's guys that take it and their receptors in their body is not prone to this. And they're the guy in the gym with the acne and the traps up to here and their body's broken out and they can't develop much body parts and they just look very bloated. Would that be a reason why somebody would do a second, thing, because the receptors are not used to it or not getting the numbers?
I'll be honest with you, anybody that I've ever seen with any acne problems, front, chest, back, whatever it is, it's usually a hormonal imbalance.
Okay.
Usually the bloating, that's a hormonal imbalance. And usually that's going to be estrogen is running high. That is the main thing. I will bet on it almost 9 out of 10 times you're going to find that. The only issue that I'd ever see with somebody taking testosterone, usually, the dose might be different if the guy may be bigger, might have been taking it for years before by himself, and might need a little bit higher dose than 200, right? They're going to 300, and that's the maximum we give. Right. But at that point, their numbers should be dialed in. If those numbers are dialed in, the only thing, like I said, for oxandrolone, listen, it does have some medical use. Right. So burn victims, you have atrophy, you've got done with a surgery, you're trying to heal better. Definitely. Right. But as far as a weight loss medication, definitely not. There's way better things that are going to be weight loss. And the only other problem with oxandrolone is it is pushed it's like the minimal side effect steroid, right? Anabolic. But the thing about it is it's a DHT derivative, right? Dihydrotestosterone. And DHT, when those levels go too high, you're going to start losing hair. And if you're predisposed to baldness, you're going to lose even more. That's why girls do it all the time. I don't know how many female bodybuilders, and I love them to death, have lost a ton of their hair by using a lot of these different compounds. And oxandrolone is one of the main culprits for it.
There you go.
So and there it's pushed a lot. And there's people that go into a HRT or TRT clinic or an anti-aging clinic, and they're just going to get help. And they say they want this, and this effect, and they have no idea what some of these drugs are, and they get prescribed some of these different things, and they're like, "Well, this is what the doctor prescribed, and this is why I'm taking it." And it really is. The doctor's doing them a disservice by doing it.
Yeah.
Yeah.
I'm always told that from the more intelligent individuals I speak to about these situations is that you can only fill up your gas tank so high, and then the rest spills out. And so you're talking about that protocol of 200 or 300. That's pretty much all you need to do. The extra stuff is the guy that's trying to do something more. And I guess for yours and my belief, that's not sustainable.
Definitely not.
It's just a short-lived life on that. But either way, whatever your choice is, guys, I'm just here to try to get you guys to go on over there and talk to somebody so you understand this stuff and understand it fully so you can make the right decisions for yourself. And again, the number's right here on the page. And you can talk to one of John's incredible
medical staff,
wellness providers. What's some of the other names?
Our medical assistants and stuff like that will be answering the phone. Stuff like that. Our nurse practitioners will be on there for you. They're all in, man. Our medical staff is very knowledgeable here and definitely want to take care of our patients.
Well, let's jump back on over real quick here, Johnny, just for some of these questions. I'm seeing these guys I love that you guys are interactive today, and it's not just me and Johnny talking, but you guys can get in here. This really is, it's not my time. This is your time for you guys to talk to John, and I'm bringing you guys John to talk to. So This is when you get to ask him straight up questions for you.
Yeah, how to gain lean muscle, how to lose weight, how to increase bedroom performance, how to increase mental clarity. That's another one out there. And energy. How many people out there need energy? Every day, are you guys going, you guys are grabbing an energy drink and drinking 1 or 2 or 3 or 4 or 5 a day? I do know a ton of people that do this. And, if you're having to do that much per day or 2 pots of coffee per day, then there might be something that, you're covering up or masking that has an issue that you could probably fix, or you could probably find something that works a lot better as far as what you need to get energy from.
Here's a couple questions. This one's going to be a hard one for me to answer.
Yeah.
I don't know why you have a backache. What's going on there?
Back acne.
Oh, back acne. Sorry.
Yeah.
That's what you get for not wearing glasses. Johnny, you can handle that one.
Sure.
Is that something you guys could see in the blood work as well as maybe something he's doing with his diet?
Sure. So obviously diet, we can't see what you're eating unless you let us know what you're eating, right? We could see that through cholesterol and triglycerides, maybe like, hey, your diet looks like it's pretty poor, like that. Obviously, we would ask them the questions of how their diet was when they go into a consultation with us right beforehand, so we kind of get a gist of that. Blood work wise, you could tell if, like I said, if somebody has been taking hormones and you run a blood test on them and you see estrogen, testosterone ratios and stuff like that, and something's off there, you could probably be like, this is attributed to why you got back acne. If somebody blood work looks all right, they're still dealing with acne, we do have a protocol for these patients, and it gets rid of it pretty quick. When you're talking about something like that, you're going to want to do 2 different things. We have a protocol. We have our clindamycin pads. So it's actually an antibiotic, and like it looks like those old oxy pads, the circle ones.
Oh, yeah.
Comes in the same package. You use that, and basically we have a wash, and the wash is another antibiotic wash, and basically you would wash yourself with it in the shower or the bath, and then when you get out, you use the pads, and it would pretty much go away. I think we're in a couple weeks, maybe 1 or 2 weeks, and you're gonna see a substantial difference. Anybody that's ever had acne with us, we throw them on that protocol. It's gonna be good to go. If it gets real bad, some people have really bad acne and have never got away from it, then you might need a different medication. We don't do it currently, but we might look into it as Accutane. Accutane, it can damage the liver, right? So you have to make sure that you're monitoring everything, make sure everything's good, but it does work very well.
That was one of the big things I think I took when I was going through puberty.
I took it.
Yeah.
Never got acne afterwards.
Right?
Never.
Just during that growth spurt is when I had to take that.
Yeah.
So
your hormones are all over the place.
Hormones are all over the place, right?
That's what it is.
It's okay. I put 100 pounds muscle on, so I was all right with that puberty going through. There's just some more on here. Jeffrey, you as well. If you see something on here.
Will the hormones give me sideburns like Mike? So it's a good question, right? Does testosterone or hormones increase hair? Yes, it will. It will increase hair pretty much everywhere except for here. That's it. Everywhere else, you'll gain hair. I mean, your face.
Except the one place you want it.
Except the one place you want it is right here. It will not do right here. It will do everywhere else. So at that point, if you want more increased facial hair, you could do that. But there are other things you could do to increase facial hair too, or keep the hair that you got and everything like that. It's our hair foam. That thing it's amazing. Minoxidil, finasteride, lantropost. So you're talking about thickening the hair, keeping the hair, and at that point sustaining, lower DHT levels. And that's one of the big things out there. People get on testosterone, they take a lot of testosterone, and even females, if that DHT level is up, I'm telling you, you will start thinning out. And females especially get really upset. There are some guys that would lose their wig, but a lot of guys, it's a 50-50 split. They'll shave their head before they care. But females, they don't want to wear wigs.
I have a question. This is a question I have is that when it comes to women doing testosterone, at the level that an HRT or TRT company would run, it's just to, again, get you back to a healthy level in that range. will their voices still change?
No.
Because that's the one thing I see with these girls in the health and fitness world. Their voices change in such a odd way. Um, so it's not it's the amount that they're doing,
Yes.
not the actual
Yes.
chemical in the sense of just
No.
taking a basic dose, I guess you would say.
Yeah. So I mean, think about this, Mike. I mean, just rationally, if me or you were within at 900 as a total testosterone and 18 for a free, we're normal, right? And let's say we're taking 100 milligrams to get us there. Nothing different as far as what the body would produce, right? Females the same way. If you keep them within the range, this is normal for their body. Now, if we start going super physiological and then we start adding more anabolic compounds,
Right.
the more you're going to change. It's going to viralize and you're going to change. I mean, that's what it is. I mean, if you really think about it. If you're going to change, per se, if I wanted to change into a girl, then I would take a testosterone blocker. I would add estrogen in, and that would increase all my femininity, right? Same thing with a girl. We give them anabolic or testosterone at levels that we should be taking as guys, they're going to start getting some traits like guys. That's why they sound like me and you. And some of them got some better facial hair, possibly.
And the baby carrot. Don't forget the baby carrot.
Yeah,
That's what we don't want the women to get.
yeah. That's kind of scary. Yeah, I don't know. Some guys like that, not me, for sure. I've definitely seen some crazy.
I'm not pointing at nobody. What? That being said, one of our incredible Titan Medical people here is Mary, and she's talking about the amount of sleep that she's getting. If I'm understanding this correctly, I get more than 4 hours of sleep. It's like monkey chatter. Sleep is so important. It's something I so skipped out on as a youngster. I was one of these guys that says I can sleep when I'm dead kind of concept.
I hear that.
And everybody knows that for the majority of my career, I was a 4 a.m. training. I would always train at 4 a.m. And ever since the lockdown, I never went back to that 4 a.m. I'm more like a 6 or 7 in the morning now, and I'm trying to get that good 8 hours of sleep. What's your recommendation on that? Because you're giving up one aspect of the concept of I want to get up early. I want to be more productive. I want more days in the. Arnold said it best. You need 8 hours. Sleep faster. It's like, yeah, I understand that concept and that mindset. How do you deal with the battle of going, hey, I can work till 10, 11. I'll get up at 5 in the morning.
Yeah.
But you're giving up that sleep, which again goes back to health in the long run. What's your recommendation?
Man, I mean, I would recommend to try to sleep more. I mean, I know that I don't do that. So, I mean, I guess I can't even say that because I got to do it to at least say it, you know? I mean, walk the walk, talk the talk, right? But at that point, like, I don't know, sometimes there's sacrifices you have to make, and you're making these educated sacrifices, decisions. So
less sleep an educated sacrifice, though?
To me, I mean, I guess, right? Because I know I have to get up and I have to do these things. But do I know that sleep is vital and would make me probably perform better and feel better? Yes, 100%. So I definitely try to prioritize sleep more than I did before, but it's tough. Like I said, when you have responsibilities and you got things going on, you have to do. It's one thing if I didn't. If I didn't, trust me, I'd be sleeping, naps during the day. I mean, you talk to me on the weekend sometimes. And if I don't got nothing to do, I'm catching up on sleep so I can get ready for the week. Because you can bank sleep, or you can deprive yourself of sleep. So at that point, if you miss some hours during the week, I've read some studies where you can sleep those hours during the weekend and recover some of those hours. So that's kind of where I'm at with it. I'm trying to just, where I can, I get it where I can. And if I can't get it, then I know that, listen, I'm going to be working, I'm going to be doing something where I have to do it. So at that point, it is what it is. But I mean, there's so many different studies just about dementia, like earlier stage dementia, just from not getting proper rest. So there's a lot of things that go along with it. And, you know, I definitely think sleep should be a priority for sure. And I have to work on my priority of sleep too as well. Because I probably only get like maybe 6 hours. and that's on a good day.
Yeah, I wanted everybody to hear that because of the fact that I know that you are a worker, and I
Yeah.
know that you're 7 days a week.
Yeah.
And there's times, trust me, I'm on the West Coast. This guy's on the East Coast, and there's times I'm in bed before he is, and he's still up before me the next day. So I know this is something that you and I
Oh yeah.
say that we need.
We share it.
Um, but at the same time, it's not the easiest thing, and we understand that eating clean every day is not easy. Training
Yeah.
every day is not easy, but and again, sleeping and just going, hey, I'm getting my 8 hours is not easy. But we got to keep pushing. We got to keep trying, guys. I know that's a tough one.
Yeah, it is a tough one, but prioritize sleep if you can, and get it when you can.
We got a guy here, Joe, Big Joe, is going to get his blood work done tomorrow. Man, I look forward to hearing back the results and
Yes.
what if possible, Titan Medical can do to help Big Joe.
Yes, definitely. Where's it going?
Let's jump down.
For 3 hours, but bring that shit off.
And then we got Art there helping out.
Yeah.
Let's see. I just can't. Oh, Mary, I was talking to the team, and John was mentioning this because I am dieting really, really hard, and I notice when I am dieting and the body fat is getting next to none, and the food is next to none, it is hard for me to fall asleep and stay asleep. John recommended something, and I think I've been on it now for 4 weeks, 5 weeks. And John, can you go into this? What you recommended?
Sure.
It's a one shot each night before bed.
Yep.
And it has helped me tremendously at this stage. So I can't fathom what it's going to do when I'm off season, but right now it's helped me.
Yeah, it's definitely a good one. It's called Titan Serenity, and it's all natural components. It's got L-theanine, magnesium, and taurine in it. And there's two types of sleepers that are out there. There's people that can't go to sleep, and there's people like you, like if you're just your brain is just going a million miles an hour and won't stop. That's one. And then there's two. There's a person that goes to sleep and wakes up every hour on the hour. So at that point, this combination of these three things have helped patients tremendously. And like I said, it's a natural way. There's no narcotics in it or anything that's going to be addictive. It's going to be things that are going to benefit your health. So L-theanine is one of the big ones that are in there. What it does is it lowers down your thinking as far as that goes. It takes away anxiety. There's people that get social anxiety too as well. So it kind of calms you down. It puts you in a more relaxed state. It's not going to just knock you out when you take this shot, and I don't want people to think that. But magnesium is another one that works along with it. It also distributes hormones, but it will relax you even more too as well. So you're putting your mind into a better state, a more rested state. And then taurine is great for brain function. It's great for a number of different things, but brain function is one of them as far as that goes. So you wake up refreshed. That's the big thing that people want to do. They want to go to sleep, stay asleep, and wake up refreshed. And it really does help a lot of patients along with this.
Agreed. And like I was saying, Mary, this is something I've been doing for the last 5 weeks, and it's helped me at this stage. And this is the worst stage for my sleep. When I need it the most, it is something that hits me, and it's like, oh. So this is so great.
Absolutely. I mean, sleep is a big one. It definitely is a big one. Think about it. If you don't sleep, you're up most of the night, hour by hour. The next day, you got to go into your job, right? And let's say you're a police officer, where you have some very important job that you have to be like on point with, because if you're not on point, something bad could happen to you or somebody else. It's really important because you can't think as fast. It's not there. It could affect the mood. You might not be in the best mood when you don't sleep too as well. So there's a lot of negative things that can go along with not getting sleep.
I got a couple questions here. Easy ones for you to answer. There's one.
Does testosterone go into the bloodstream or does it go into the body? Well, it technically goes into both. When you inject intramuscular per se, it's going into the body, into the muscle, and then it's going into the bloodstream. So that's how it works. Pretty simple, pretty easy.
Yeah, pretty easy. Blood takes things around the body.
Yes, it starts circulating.
Here's one for you.
Sure. I mean, I'm 40. My test levels are high, and I have more muscle and strength than ever. 47 isn't as older man, in my opinion. Mike is 55, still amazing. I want to be like that as I get old, real old. Don't we all want to be like Mike when we get older? And, age is just a number for sure, because we've talked about this before, me and Mike, about chronological age and biological age. And chronological age is your age, 1, 2, 3, 4, so wherever you're at in that year state. But biological age is what your body is really aged to. So you could be 56 years old and have a 35-year-old body. It really depends on how much you take care of preventative and what you're doing for your body. It's not just going to stay like that. If you beat it up, abuse it, not take care of it, not do anything to help it, it's going to wear down like anything else. But if you take care of it and you do the right things and you're being preventative, then you're going to age gracefully and slower than your biological age. So yeah, it's definitely doable. I don't know to the extent of where Mike's at. We'll see. I mean, listen, medicine, everything's getting better, and hopefully some people can reach that level. But at that point, you will be the best you possibly can be, and that's what you need to worry about. Because getting caught up on what somebody else looks like or you need to worry about how well you're doing and what you look like, and how can you make yourself better instead of worrying about how do I get to that point. Worry about yourself, do the right things, and you'll get to where you need to be.
And again, I think I said it earlier, is that goes back to the blood work on finding out where you're at and what you can do. And again, from Bobo that's sitting over here to optimizing his health to me getting probably in the best shape of my entire career. And we're going to plan a shoot in April. And I spoke about this earlier, is I will be in Florida here at the beginning of April. And I get to unveil the artwork, I guess you would say.
Yes, the masterpiece.
And show, along with the training I've been doing and everything, but what extra, that protocol from Titan Medical has helped me from strength, skin, hair, body, sliceness, diceness. So we get to unveil that Ferrari, I hope to be.
Oh, yeah.
Between a Ferrari and a Hummer.
That's right.
Things are beastie.
They are. They definitely are,
God.
man.
Johnny, thanks again for doing this, man.
I
And
appreciate
again,
it.
for everybody, Tessa Memorial is what John talked about last week.
Mm-hmm.
And this week we talked about copper.
Yep, GHKCU.
So these again, John, go over both of those real quick again, just
Sure.
for these guys that are just coming on the end here.
Sure. Testosterone is an FDA-approved peptide. It's a GHRH peptide. That means growth hormone-releasing hormone peptide. What it's going to do for you is it's going to naturally raise your own growth hormone levels, and it's going to target visceral and belly fat. So at that point, you're getting some great things out of this for anti-aging effect, being able to build lean muscle, lose weight, target specific belly fat too as well. FDA approved. It's a great drug. Testosterone. The next one, GHKCU. This is a copper peptide, and it's going to do a lot of great things as far as creating more collagen, better elasticity for the skin. It's going to help regenerate your skin. So at that point, if you've had an accident, you've had a surgery, it will help the skin grow back better, and will also help with anti-inflammatory and antioxidant purposes. So if you have inflammation in the body, this is going to help tremendously with that. It also helps with remodeling the skin. And I talked about that earlier. Remodeling the skin means changing the skin. So if you have wrinkles, if you have lines, it can help remodel that skin to make it better.
There we go. Guys, head on over to Titan Medical. Get in a phone call with them. Get your blood work done. Start optimizing your health the very best you can. And that means you too, Bobo.
Yeah.
Today, Get over there, start talking to them. Let's rock and roll.
Call me, John.
I'll have somebody give you a ring.
Look at this guy. Oh, boy. Man, Johnny, thank you as always, brother.
Thank you, guys.
We'll schedule this trip out there in April.
Yeah. Can't wait.
That's it, man. Enjoy the day. Enjoy. We'll see you soon.
I'll see you guys later. Thank you guys for having me. Appreciate it, Mike.
Thanks, buddy.
Bye-bye.